Question 1. A phlebotomist is preparing to draw blood from a patient with a known history of fainting during venipuncture. What is the most appropriate initial action to ensure patient safety? A. Position the patient in a supine or semi-Fowler's position. B. Have ammonia inhalants readily available at the bedside. C. Instruct the patient to look away from the venipuncture site. D. Apply the tourniquet immediately and locate a vein. Answer: A. Position the patient in a supine or semi-Fowler's position. Explanation: This question tests critical thinking regarding patient safety during venipuncture, especially for patients prone to syncope, fainting. The keyword most appropriate initial action emphasizes preventative measures. Positioning the patient lying down, supine, or reclined with legs elevated, semi-Fowler's, significantly reduces the risk of injury if they faint, as it prevents falls and promotes blood flow to the brain. While having ammonia ready or telling them to look away might help manage symptoms or distraction, ensuring a safe physical position is the primary preventative safety step. For example, always have a patient prone to fainting lie down, even if they say they feel fine, because preventing a fall is paramount. Always prioritize patient positioning to prevent injury from syncope before anything else. Question 2. Which of the following conditions would make the dorsal side of the hand the least desirable venipuncture site? A. Patient has large, easily visible veins on the hand. B. Patient is an elderly individual with fragile skin and rolling veins. C. Patient has a history of difficult draws in the antecubital fossa. D. Patient is receiving 4 fluids in the contralateral arm. Answer: B. Patient is an elderly individual with fragile skin and rolling veins. Explanation: This question focuses on site selection and challenges associated with specific patient populations. The keyword least desirable directs you to identify a contraindication or significant difficulty. Elderly patients often have fragile skin and superficial, rolling veins on the dorsal hand, making successful venipuncture without causing trauma, like a hematoma, very challenging compared to deeper, more stable veins. While large veins are desirable, and 4 in the other arm might lead you to the hand, the fragility in elderly skin makes it a last resort. For instance, attempting to draw from a very fragile hand vein in an elderly person can easily lead to a blown vein and bruising. Always assess skin and vein integrity carefully, especially in geriatric patients, to avoid unnecessary trauma. Question 3. A phlebotomist has just completed a blood draw and removed the needle. The patient expresses concern that they are on anticoagulant therapy, blood thinners. What is the most critical action for the phlebotomist to take immediately? A. Apply firm pressure to the venipuncture site for an extended period. B. Place a small bandage over the site and instruct the patient to hold it. C. Elevate the patient's arm above heart level to reduce bleeding. D. Ask the patient about their last dose of anticoagulant medication. Answer: A. Apply firm pressure to the venipuncture site for an extended period. Explanation: This question tests knowledge of post-venipuncture care, especially for patients with specific medical conditions like anticoagulant therapy. The keyword most critical action immediately highlights the priority for preventing complications. Anticoagulants impair blood clotting, so applying firm and sustained pressure, usually for 5 to 10 minutes or more, depending on the facility protocol, to the venipuncture site is essential to prevent hematoma formation and excessive bleeding. While assessing medication timing is important, the immediate physical action to control bleeding is paramount. For example, failing to apply sufficient pressure could lead to a large, painful bruise at the site, which is preventable. Remember that preventing hematomas in patients on blood thinners relies heavily on prolonged, direct pressure. Question 4. A stat order arrives for a complete blood count, CBC, and a prothrombin time, PT, for an emergency department patient. The patient has a history of extremely difficult venipuncture. After 2 unsuccessful attempts, the phlebotomist should A. Attempt a third venipuncture at a different site. B. Notify the charge nurse or physician for assistance. C. Perform a capillary puncture to obtain the specimens. D. Ask another phlebotomist to attempt the draw immediately. Answer: B. Notify the charge nurse or physician for assistance. Explanation: this question evaluates the phlebotomist's professional responsibility and adherence to policy when faced with difficult draws, particularly in an emergency. The keyword after 2 unsuccessful attempts indicates a specific procedural limit. Standard phlebotomy practice dictates that a phlebotomist should not attempt more than 2 venipunctures on a patient before seeking assistance from another qualified phlebotomist or notifying the nursing staff or physician. This policy protects the patient from excessive pain and trauma and ensures timely specimen collection. For instance, if you fail twice, it's best to step back and let someone else try or get a different collection method approved, rather than causing more distress. Always remember the 2-stick rule to ensure patient comfort and safety. Question 5. Which of the following is the primary reason for using a winged infusion set, butterfly needle, for venipuncture? A. To ensure a faster blood flow during collection. B. To reduce the risk of hemolysis in delicate veins. C. To facilitate collection from small or fragile veins. D. To minimize discomfort for pediatric patients. Answer: C. To facilitate collection from small or fragile veins. Explanation: this question assesses the specific application and advantages of different phlebotomy equipment. The keyword primary reason asks for the main purpose of the device. A winged infusion set, commonly known as a butterfly needle, has a smaller gauge needle and flexible tubing, which makes it ideal for accessing small, superficial, or fragile veins that are difficult to stick with a standard straight needle. While it might be used in pediatric patients or could potentially reduce hemolysis due to slower flow, its fundamental advantage is its precision for challenging veins. For example, a butterfly needle is perfect for drawing blood from a hand vein in an elderly patient or a tiny vein in an infant. Understand that the butterfly's design is specifically for targeting difficult-to-access or delicate vessels. Question 6. A phlebotomist accidentally sticks themselves with a used needle. After immediately washing the exposed area with soap and water, what is the next most critical step according to OSHA guidelines? A. Complete an incident report form within 24 hours. B. Seek post-exposure medical evaluation and follow-up. C. Inform the patient about the accidental needle stick. D. Apply an antiseptic solution to the puncture site. Answer: B. Seek post-exposure medical evaluation and follow-up. Explanation: this question tests knowledge of immediate post-exposure protocols for needle stick injuries, which is a crucial aspect of phlebotomy safety. The keyword next most critical step after initial washing points to the mandatory health response. OSHA, Occupational Safety and Health Administration, guidelines require immediate post-exposure medical evaluation and follow-up for any contaminated sharps injury to assess the risk of bloodborne pathogen transmission and initiate appropriate prophylactic treatment if necessary. While incident reports are important, an antiseptic is helpful, ensuring medical assessment is paramount for the phlebotomist's health. For instance, receiving prompt medical attention can significantly reduce the risk of contracting infections like hepatitis B or C, or HIV. Always prioritize your health by seeking immediate medical attention after any sharps injury. Question 7. What is the correct order of draw for a capillary puncture when collecting specimens for a CBC, electrolyte panel, and bilirubin? A. Bilirubin, CBC, electrolyte panel. B. Electrolyte panel, bilirubin, CBC. C. CBC, electrolyte panel, bilirubin. D. CBC, bilirubin, electrolyte panel. Answer: D. CBC, bilirubin, electrolyte panel. Explanation: this question assesses a nuanced but critical aspect of specimen collection, the order of draw for capillary punctures, which differs from venipuncture. The correct order of draw is vital to prevent additive carryover and ensure accurate test results. For capillary collections, blood gases, if collected, lavender, EDTA, tubes for hematology tests like CBC, and then other additive tubes like green, heparin, or gray, oxalate/fluoride, are drawn first, followed by serum tubes. This order is prioritized to minimize platelet clumping in the CBC and to ensure additives don't contaminate other tests. For example, drawing the CBC first ensures the platelet count is accurate, as platelet aggregation can occur quickly in capillary blood. Remember that for capillary draws, blood cultures, if applicable, and hematology tubes like CBC always come before other tubes. Question 8. A phlebotomist is asked to collect a cold agglutinin test. Which special handling requirement is critical for this specimen? A. The tube must be kept at body temperature, 37 degrees Celsius. B. The specimen requires immediate chilling on ice. C. The blood must be centrifuged within 15 minutes of collection. D. The sample must be protected from light. Answer: A. The tube must be kept at body temperature, 37 degrees Celsius. Explanation: this question tests specific knowledge about specialized specimen handling, which is crucial for certain diagnostic tests. The keyword cold agglutinin is the direct clue. Cold agglutinins are antibodies that react, clump, with red blood cells at temperatures below normal body temperature, so the specimen must be kept warm, at 37 degrees Celsius or body temperature, during transport and processing to prevent this clumping and ensure accurate results. Chilling or light protection are for different tests, and immediate centrifugation isn't the primary concern here. For example, if a cold agglutinin sample is allowed to cool, the agglutinins will activate, leading to inaccurate results that don't reflect the patient's true condition. Always remember to keep cold agglutinin specimens warm to prevent false positives. Question 9. Before performing a venipuncture, a phlebotomist palpates a vein that feels hard, cord-like, and lacks resiliency. This condition is most indicative of A. An artery. B. A healthy, strong vein. C. A thrombosed vein. D. A superficial tendon. Answer: C. A thrombosed vein. Explanation: this question assesses the phlebotomist's ability to identify unsuitable venipuncture sites through palpation. The descriptors hard, cord-like, and lacks resiliency are key indicators. A thrombosed vein is one that has been clotted or hardened by repeated punctures or inflammation, and it will feel firm and unyielding due to the presence of thrombi, clots. Such veins are not suitable for venipuncture because they may not yield blood, or the blood obtained may be hemolyzed or clotted. While an artery pulsates, and tendons are typically not mistaken for veins, a thrombosed vein is a common finding that must be recognized. For instance, attempting to draw from a thrombosed vein often results in a blown vein or no blood return, causing patient discomfort. Always rely on palpation to ensure the vein is patent and resilient before attempting a stick. Question 10. A phlebotomist is drawing blood from a patient when the patient suddenly complains of sharp, radiating pain down their arm. What should the phlebotomist do immediately? A. Reposition the needle slightly to alleviate the pain. B. Continue the draw quickly to minimize discomfort. C. Withdraw the needle immediately. D. Ask the patient to tolerate the pain for a few moments. Answer: C. Withdraw the needle immediately. Explanation: this question tests critical decision-making in response to a serious venipuncture complication, potential nerve damage. The phrase sharp, radiating pain is the crucial keyword, indicating that the needle may have contacted a nerve. If a patient experiences this type of pain, the phlebotomist must immediately withdraw the needle to prevent further nerve damage. Repositioning or continuing the draw could exacerbate the injury. For example, if a needle pricks a nerve, continuing the draw could cause permanent nerve damage, leading to numbness, tingling, or weakness. Prioritize patient safety. Always withdraw the needle instantly if a patient reports sharp, radiating pain during venipuncture. Question 11. Which of the following specimens is most sensitive to hemolysis during collection and transport? A. Complete blood count, CBC. B. Electrolyte panel, e.g., potassium. C. Coagulation studies, e.g., PT/INR. D. Blood culture. Answer: B. Electrolyte panel, e.g., potassium. Explanation: this question assesses knowledge of specific test sensitivities to pre-analytical errors like hemolysis. The keyword most sensitive to hemolysis directs you to identify the test most affected by red blood cell breakdown. Hemolysis releases intracellular components, like potassium, into the serum or plasma, leading to falsely elevated results for tests like potassium, part of an electrolyte panel. While hemolysis can affect other tests, its impact on potassium levels is particularly significant and clinically relevant. For example, a hemolyzed sample for a potassium test could falsely indicate hyperkalemia, leading to incorrect treatment. Always handle specimens gently, especially those for electrolyte testing, to prevent red blood cell damage. Question 12. A phlebotomist is collecting a blood culture using the aerobic and anaerobic bottles. Which bottle should be inoculated first from the syringe or collection adapter? A. Aerobic bottle. B. Anaerobic bottle. C. It does not matter which bottle is inoculated first. D. The bottle with the largest volume. Answer: A. Aerobic bottle. Explanation: this question tests a specific detail of blood culture collection technique, which is crucial for accurate microbiology results. When collecting blood cultures using a syringe or a winged infusion set with a direct draw adapter, the aerobic bottle should be inoculated first. This is because the collection device, syringe or adapter, will contain a small amount of air, and inoculating the aerobic bottle first ensures that any air is transferred to the bottle designed for oxygen-loving organisms, preventing it from entering the anaerobic bottle. For example, inoculating the anaerobic bottle first could introduce oxygen, inhibiting the growth of anaerobic bacteria if present. Remember, A comes before N in the alphabet, just as aerobic comes before anaerobic in blood culture collection. Question 13. A patient refuses a venipuncture, stating, "You're not sticking me today." What is the appropriate course of action for the phlebotomist? A. Gently persuade the patient, explaining the importance of the test. B. Document the refusal and notify the patient's nurse or physician. C. Inform the patient that refusal could lead to medical complications. D. Attempt to draw the blood quickly before the patient can object further. Answer: B. Document the refusal and notify the patient's nurse or physician. Explanation: this question addresses patient rights and professional conduct regarding informed consent. When a competent adult patient refuses a procedure, even if it's medically necessary, the phlebotomist must respect their decision. The appropriate action is to acknowledge the refusal, document it thoroughly, and then notify the healthcare team, nurse or physician, responsible for the patient's care. It is never acceptable to coerce a patient or attempt to draw blood against their will, as this could be considered assault. For example, if a patient refuses a draw, do not argue or try to convince them. Instead, simply document and inform the nurse so they can address the patient's concerns or seek a doctor's order. Always respect a patient's right to refuse, document the refusal, and inform the appropriate medical staff. Question 14. What is the most common reason for a specimen to be rejected by the laboratory? A. Incorrect patient identification. B. Specimen collected in the wrong tube type. C. Insufficient quantity, QNS. D. Hemolysis. Answer: B. Specimen collected in the wrong tube type. Explanation: this question focuses on pre-analytical errors and their impact on specimen rejection, a common issue in phlebotomy. While all listed options can lead to rejection, collecting a specimen in the wrong tube type is often cited as the most common reason for rejection. Each test requires specific additives or lack thereof to ensure stability and accurate results, and using the incorrect tube renders the specimen unsuitable for analysis. For example, collecting a coagulation test in a lavender top, EDTA, tube instead of a light blue top, citrate, tube will make the coagulation results invalid. Always double-check the requested tests against the required tube types before every draw to prevent miscollection. Question 15. When performing a capillary puncture on an infant, the lancet depth should not exceed how many millimeters? A. 1 millimeter. B. 2.0 millimeters. C. 2.5 millimeters. D. 3.0 millimeters. Answer: B. 2.0 millimeters. Explanation: this question tests critical safety knowledge specific to pediatric capillary punctures. The depth of the lancet is crucial to prevent injury to the bone, osteomyelitis, in infants, whose heel bone is very close to the skin surface. For infants, typically less than 12 months old, the lancet depth should never exceed 2.0 millimeters. Exceeding this depth poses a significant risk of bone damage. For example, using a lancet designed for adult finger sticks on an infant's heel could be too deep and cause serious complications. Always use a lancet specifically designed for infant heel sticks, which are depth controlled to 2.0 millimeters or less, to ensure safety. Question 16. A phlebotomist is asked to collect blood from a patient with an N4 infusion running in the right antecubital area. The most appropriate site for venipuncture is A. Distal to the foresite in the right arm. B. Proximal to the foresite in the right arm. C. The antecubital area of the left arm. D. Any vein in the left hand. Answer: C. The antecubital area of the left arm. Explanation: this question assesses problem-solving and site selection when N4 is present. The general rule is to avoid drawing blood from an arm with an active N4 infusion, as the N4 fluid can dilute the blood specimen and lead to inaccurate test results. The most appropriate site would be the opposite arm. While a left-hand vein, option D, is also acceptable, the antecubital area usually offers larger, more stable veins. For example, drawing below N4 would dilute the sample, and drawing above it could still lead to inaccurate results due to medication infusing. Always prioritize the opposite arm first when N4 is present to ensure specimen integrity. Question 17. The purpose of inverting evacuated tubes immediately after venipuncture is to A. Prevent specimen evaporation. B. Ensure proper mixing of blood with additives. C. Minimize the risk of hemolysis. D. Facilitate clot formation in all tubes. Answer: B. Ensure proper mixing of blood with additives. Explanation: this question addresses proper specimen handling post-collection. The keyword purpose of inverting focuses on the reason for this critical step. Inverting tubes, typically 5 to 10 times depending on the tube type, ensures that the blood thoroughly mixes with any additives, anticoagulants, clot activators, gels, present in the tube. Proper mixing is essential for preventing clotting in tubes meant for whole blood or plasma, or for ensuring complete activation in tubes meant for serum. For example, failing to invert a lavender top tube, EDTA, immediately will cause the blood to clot, rendering it unsuitable for a CBC. Always invert tubes immediately and gently the correct number of times to ensure additive efficacy and accurate results. Question 18. A phlebotomist is preparing to draw a blood alcohol content, BAC, specimen. Which antiseptic should not be used for site preparation? A. Isopropyl alcohol. B. Povidone iodine. C. Chlorhexidine gluconate. D. Benzalkonium chloride. Answer: A. Isopropyl alcohol. Explanation: this question tests specific knowledge about antiseptic use for certain tests. The keyword blood alcohol content, BAC, is the critical clue. Isopropyl alcohol, the most common antiseptic for venipuncture, contains alcohol and could falsely elevate the patient's BAC results if it contaminates the specimen. Therefore, a non-alcohol-based antiseptic like povidone iodine, chlorhexidine gluconate, or benzalkonium chloride must be used for BAC collections. For example, using an alcohol swab before a BAC draw could lead to a legal dispute if the results are contested. Always choose a non-alcohol antiseptic for blood alcohol tests to ensure accurate results. Question 19. Which of the following describes the primary purpose of a tourniquet in venipuncture? A. To stimulate nerve endings, making veins more palpable. B. To restrict arterial blood flow into the extremity. C. To engorge the veins, making them more visible and palpable. D. To prevent venous blood flow back towards the heart. Answer: C. To engorge the veins, making them more visible and palpable. Explanation: this question assesses the fundamental understanding of a tourniquet's function. The primary purpose of a tourniquet is to apply pressure just above the venipuncture site, which temporarily impedes venous blood flow back to the heart while allowing arterial blood flow into the limb. This causes the veins to fill with blood, becoming distended, engorged, more prominent, and easier to locate and puncture. It doesn't restrict arterial flow or stimulate nerves. For example, without a tourniquet, many veins would be too flat or small to easily access. Remember, the tourniquet makes the veins pop out by temporarily pooling blood in them. Question 20. A patient informs the phlebotomist that they have a latex allergy. Which supply is most critical to confirm is latex-free before beginning the draw? A. Tourniquet. B. Alcohol pad. C. Gauze pad. D. Adhesive bandage. Answer: A. Tourniquet. Explanation: this question assesses awareness of common allergens in phlebotomy supplies and prioritizing patient safety. While some adhesive bandages might contain latex, and gauze or alcohol pads typically do not, latex tourniquets are a very common source of latex exposure in the phlebotomy setting. It is most critical to ensure the tourniquet is latex-free because it directly contacts the patient's skin for an extended period during the setup, potentially causing a severe allergic reaction. For example, a severe latex allergy reaction can manifest as hives, swelling, or even anaphylaxis. Always confirm that all supplies, especially tourniquets and gloves, are latex-free when a patient reports a latex allergy. Question 21. Which of the following actions is a direct violation of HIPAA regulations? A. Discussing a patient's lab results with another phlebotomist in the break room. B. Documenting a patient's refusal to have blood drawn in their chart. C. Sharing patient identification information with a healthcare provider involved in their care. D. Reporting suspected child abuse to the appropriate authorities. Answer: A. Discussing a patient's lab results with another phlebotomist in the break room. Explanation: this question tests knowledge of HIPAA, Health Insurance Portability and Accountability Act, regulations, specifically regarding patient confidentiality. HIPAA protects patient health information, PHI, and prohibits its disclosure to individuals not directly involved in the patient's care, especially in non-private settings. Discussing a patient's lab results in a public or semi-public area like a break room, even with another healthcare professional, if they are not directly involved in the patient's care, is a breach of confidentiality. For example, imagine overhearing details about a neighbor's health. This is exactly what HIPAA aims to prevent. Always ensure patient information is discussed only on a need-to-know basis and in private settings to maintain confidentiality. Question 22. A phlebotomist is preparing to collect a blood specimen for a fasting glucose test. The patient states they had a small cup of black coffee an hour ago. What is the most appropriate action? A. Proceed with the draw, as black coffee does not affect glucose levels. B. Inform the nurse or physician, as the fasting status may be compromised. C. Instruct the patient to drink more water and then draw the blood in 30 minutes. D. Reschedule the test for the next day, ensuring the patient fasts completely. Answer: B. Inform the nurse or physician, as the fasting status may be compromised. Explanation: this question assesses the phlebotomist's understanding of pre-analytical variables, specifically fasting requirements. The keyword fasting glucose test and the patient's admission of black coffee an hour ago are crucial. While black coffee does not contain sugar, caffeine can stimulate the adrenal glands, leading to an increase in blood glucose levels, potentially compromising the accuracy of a fasting glucose test. The phlebotomist should never make the decision to proceed or reschedule independently but must notify the nurse or physician, who will determine if the test can proceed or needs to be rescheduled based on their clinical judgment. For example, if a patient drinks coffee before a fasting glucose, the results might be artificially elevated, leading to an incorrect diagnosis. Always inform the care team if a patient's fasting status is compromised before proceeding with the draw. Question 23. A phlebotomist has collected blood for a serum chemistry panel in a SST, serum separator tube. How long should the tube be allowed to clot at room temperature before centrifugation? A. 5 minutes. B. 10 to 15 minutes. C. 30 to 60 minutes. D. 2 hours. Answer: C. 30 to 60 minutes. Explanation: this question tests knowledge of proper specimen processing, specifically the clotting time for serum tubes. The keywords serum chemistry panel and SST, serum separator tube, indicate the need for blood to clot completely before centrifugation. Most serum tubes, including SSTs, require a minimum of 30 minutes for complete clot activation at room temperature before centrifugation, with some guidelines extending up to 60 minutes. Spinning the tube too early can result in fibrin strands, which can interfere with testing. For example, if you spin an SST too soon, you might get a fibrin clot in the serum, requiring the lab to reject the sample. Always allow adequate clotting time for serum tubes to ensure proper sample separation and prevent fibrin formation. Question 24. Which of the following veins is considered the first choice for venipuncture in the antecubital fossa due to its size and stability? A. Basilic vein. B. Cephalic vein. C. Median cubital vein. D. Radial vein. Answer: C. Median cubital vein. Explanation: this question assesses fundamental knowledge of venous anatomy and preferred venipuncture sites. The first choice in the antecubital fossa is universally the median cubital vein. This vein is typically large, superficial, well-anchored, and less prone to rolling, making it the safest and easiest to access for most venipunctures. The cephalic and basilic veins are alternative choices, but the median cubital is preferred. For example, targeting the median cubital vein generally leads to the most successful and comfortable draws. Always aim for the median cubital vein first due to its optimal characteristics for venipuncture. Question 25. A phlebotomist receives an order for a blood culture. Which antiseptic agent is recommended for cleansing the venipuncture site to minimize contamination? A. 70% isopropyl alcohol. B. Povidone iodine or chlorhexidine gluconate. C. Hydrogen peroxide. D. Benzalkonium chloride. Answer: B. Povidone iodine or chlorhexidine gluconate. Explanation: this question emphasizes the critical importance of proper site preparation for blood cultures to prevent false positive results due to skin contamination. For blood cultures, a more stringent antiseptic technique is required than for routine draws. Povidone iodine and chlorhexidine gluconate are the recommended antiseptics because they provide superior antiseptic action against skin flora compared to isopropyl alcohol alone. For example, using just an alcohol wipe for a blood culture increases the risk of skin bacteria growing in the culture, leading to misdiagnosis. Always use a strong antiseptic like iodine or chlorhexidine for blood cultures to ensure accurate results. Question 26. Which of the following is an example of a pre-analytical error in phlebotomy? A. Incorrect laboratory instrument calibration. B. Failure to follow the correct order of draw. C. Misinterpretation of laboratory results by a physician. D. Delay in reporting critical laboratory values. Answer: B. Failure to follow the correct order of draw. Explanation: this question tests understanding of the different phases of laboratory testing and common errors. Pre-analytical errors occur before the specimen is actually tested in the laboratory. This includes patient preparation, specimen collection, like order of draw, and specimen handling/transport. Failure to follow the correct order of draw is a classic example of a pre-analytical error that can lead to additive carryover and inaccurate results. Instrument calibration and result interpretation are analytical and post-analytical errors, respectively. For instance, drawing an EDTA tube before a light blue top tube for coagulation studies is a pre-analytical error because the EDTA can contaminate the coagulation sample. Remember that anything happening before the sample reaches the lab for analysis is a pre-analytical step, and thus, where pre-analytical errors occur. Question 27. What is the primary risk associated with vigorous shaking of a blood tube after collection? A. Incomplete mixing of additives. B. Hemolysis of red blood cells. C. Premature clotting of the specimen. D. Inaccurate fill volume measurement. Answer: B. Hemolysis of red blood cells. Explanation: this question assesses knowledge of proper specimen handling and potential complications. The keyword vigorous shaking points to a common cause of sample damage. Vigorous shaking or rough handling of a blood tube can physically rupture the red blood cells, releasing their intracellular contents into the plasma or serum, a process known as hemolysis. This can significantly alter test results, especially for analytes like potassium, LDH, and bilirubin. For example, if you shake a tube violently, the sample might appear pink or red due to the ruptured red blood cells, making it unsuitable for many tests. Always mix tubes gently by inversion, never by shaking, to preserve specimen integrity. Question 28. A phlebotomist is drawing blood from a patient and notices the patient's arm is becoming increasingly swollen and discolored around the venipuncture site. What complication is most likely occurring? A. Petechiae. B. Syncope. C. Hematoma. D. Nerve damage. Answer: C. Hematoma. Explanation: this question tests the ability to recognize common venipuncture complications. The symptoms described, increasingly swollen and discolored around the venipuncture site, are classic signs of a hematoma. A hematoma forms when blood leaks out of the vein and into the surrounding tissues, causing swelling and bruising. This often happens if the needle goes completely through the vein, the needle is not fully in the vein, or insufficient pressure is applied after the draw. For example, if you see a rapidly growing bruise forming under the skin during a draw, it's a hematoma. Always remove the tourniquet and needle immediately and apply firm pressure if you suspect a hematoma is forming. Question 29. What is the maximum amount of time a tourniquet should remain applied during venipuncture? A. 30 seconds. B. 1 minute. C. 2 minutes. D. 5 minutes. Answer: B. 1 minute. Explanation: this question assesses knowledge of tourniquet application time, which is crucial for preventing analytical errors. A tourniquet should be applied for no longer than 1 minute. Prolonged tourniquet application, longer than 60 seconds, can lead to hemoconcentration, which is a temporary increase in the concentration of non-filterable blood components, like proteins, cells, and some analytes, due to fluid loss from the blood vessels into the tissues. This can result in falsely elevated test results. For example, leaving the tourniquet on for too long can make calcium levels appear higher than they actually are. Always release the tourniquet as soon as blood flow is established or within 60 seconds to prevent hemoconcentration. Question 30. A phlebotomist is preparing to perform a dermal puncture for a capillary blood gas, CBG, on a neonate. Which site is most appropriate? A. The central arch of the foot. B. The medial or lateral plantar surface of the heel. C. The tip of the great toe. D. The fleshy pad of the finger. Answer: B. The medial or lateral plantar surface of the heel. Explanation: this question specifically addresses site selection for capillary punctures on neonates, infants. The most appropriate site for a heel stick on a neonate is the medial or lateral plantar surface of the heel. These areas are typically away from major nerves, arteries, and bones, minimizing the risk of injury. The central arch, toes, and fingers, which are too small and risk bone injury, are contraindicated in neonates. For example, sticking a baby's finger can cause bone damage, so sticking the heel in the appropriate area is the safest. Always choose the medial or lateral aspects of the heel for capillary draws on infants to ensure safety. Question 31. What is the primary purpose of warming a venipuncture site, e.g., with a warm compress, prior to blood collection? A. To numb the area for less pain. B. To sterilize the skin. C. To promote vasodilation and increase blood flow. D. To prevent bruising after the draw. Answer: C. To promote vasodilation and increase blood flow. Explanation: this question assesses the physiological effect of warming a venipuncture site. The primary purpose of applying warmth, e.g., a warm compress or heel warmer for infants, is to cause vasodilation, meaning the blood vessels expand. This increased blood flow makes the veins more prominent and easier to palpate and access, especially for difficult draws or capillary collections. It does not numb the area or sterilize the skin. For example, warming a challenging vein can make it much easier to find and successfully stick. Remember that warmth brings blood to the surface, making veins more accessible. Question 32. Which of the following pieces of personal protective equipment, PPE, must a phlebotomist always wear when performing venipuncture? A. Face shield. B. Gown. C. Gloves. D. N95 respirator. Answer: C. Gloves. Explanation: this question focuses on universal precautions and essential PPE in phlebotomy. According to standard precautions and OSHA guidelines, Gloves are mandatory for every venipuncture procedure to protect both the phlebotomist and the patient from potential exposure to bloodborne pathogens. While other PPE like gowns, masks, or face shields may be required depending on the risk of splashing or specific isolation precautions, gloves are universally required for all venipunctures. For example, even a routine draw without visible splashes still requires gloves because accidental needle sticks or unexpected blood leakage can occur. Always wear gloves for every venipuncture to ensure your safety and the patient's. Question 33. A phlebotomist is preparing to collect a 24-hour urine specimen. What is the most important instruction to give the patient regarding this collection? A. Collect the first morning void of the 24-hour period. B. Discard the first morning void on the collection day, then collect all subsequent urine. C. Collect only urine passed during daylight hours. D. Collect urine only when feeling the urge, not on a strict schedule. Answer: B. Discard the first morning void on the collection day, then collect all subsequent urine. Explanation: this question tests specific patient instruction for a timed urine collection. The most important instruction for a 24-hour urine collection is that the patient should discard their first morning void on the day the collection begins, and then collect all urine passed for the subsequent 24 hours, including the first morning void on the next day. This ensures that the collection represents a full 24-hour period of renal excretion. For example, if a patient collected the first morning void, the previous night's urine would be included, making the sample longer than 24 hours. Always instruct patients to discard the initial morning void and then collect everything for the next 24 hours, including the first morning void of the second day. Question 34. Which complication can occur if a phlebotomist repeatedly punctures the same vein over a long period? A. Thrombophlebitis. B. Arterial puncture. C. Syncope. D. Hemoconcentration. Answer: A. Thrombophlebitis. Explanation: this question addresses long-term complications related to venipuncture technique. Repeatedly punctures the same vein is the key phrase. Thrombophlebitis is inflammation of a vein associated with thrombus, clot, formation, which can be caused by repeated trauma to the same vein, irritating the vein wall. This makes the vein hard, cord-like, and painful. Arterial puncture and syncope are acute complications, and hemoconcentration is a transient condition. For example, if a patient frequently gets blood drawn from the same arm due to chronic illness, their veins might become damaged and inflamed, leading to thrombophlebitis. Always rotate venipuncture sites to preserve vein integrity and prevent complications like thrombophlebitis. Question 35. A phlebotomist has just received a requisition for a blood draw. What is the first step in the venipuncture procedure? A. Assemble all necessary equipment. B. Greet the patient and introduce yourself. C. Verify the patient's identity. D. Wash or sanitize hands. Answer: D. Wash or sanitize hands. Explanation: this question assesses the very first step in the venipuncture process, emphasizing infection control. According to standard practice, hand hygiene, washing with soap and water or using an alcohol-based hand sanitizer, is the absolute first step before any patient contact and before assembling equipment. This is a critical infection prevention measure. While greeting the patient and verifying identity are crucial steps, they occur after hand hygiene. For example, even if you are about to confirm patient identity, you must first clean your hands to prevent transmitting germs. Always begin every patient encounter with proper hand hygiene. Question 36. Which of the following tests requires protection from light after collection? A. Complete blood count, CBC. B. Bilirubin. C. Blood culture. D. Prothrombin time, PT. Answer: B. Bilirubin. Explanation: this question tests knowledge of specific specimen handling requirements. Bilirubin is highly sensitive to degradation by light. Exposure to light, especially fluorescent light, can break down bilirubin, leading to falsely decreased results. Therefore, bilirubin specimens must be protected from light, typically by wrapping the tube in aluminum foil or using an amber-colored tube immediately after collection. For example, if a bilirubin sample is left on the counter exposed to room light, the results might show a lower bilirubin level than the patient truly has. Always protect bilirubin samples from light to ensure accurate test results. Question 37. A patient has significant edema, swelling, in both arms. Which action is most appropriate for the phlebotomist to take? A. Attempt to draw from the most swollen area, as veins are often larger. B. Perform a dermal puncture instead of a venipuncture. C. Notify the nurse or physician and ask for an alternative site or method. D. Apply the tourniquet much tighter to overcome the swelling. Answer: C. Notify the nurse or physician and ask for an alternative site or method. Explanation: this question evaluates the phlebotomist's judgment when encountering difficult venipuncture conditions. Significant edema indicates excessive fluid in the tissues, which makes veins difficult to locate and can dilute the blood sample, leading to inaccurate test results. The most appropriate action is not to proceed with the draw in the edematous area, but to consult with the healthcare team, nurse or physician. They may suggest an alternative site, a different collection method, or may determine the test is not feasible at that time. For example, drawing from an edematous arm could result in a dilute sample, a painful draw for the patient, and a rejected specimen. Always consult with the nursing staff or physician when faced with extreme edema in potential draw sites. Question 38. A phlebotomist is performing a venipuncture and notices the blood flow stops abruptly after initially filling a small portion of the tube. What is the most likely reason for this? A. The tube is faulty and has lost its vacuum. B. The needle has gone completely through the vein. C. The tourniquet was left on too long. D. The patient is becoming dehydrated. Answer: B. The needle has gone completely through the vein. Explanation: this question assesses troubleshooting skills during venipuncture. When blood flow stops abruptly after an initial flash, the most likely reason is that the needle has passed completely through the vein. This allows blood to leak into the surrounding tissue, potentially forming a hematoma, instead of flowing into the tube. A faulty tube would typically not draw blood at all, and a prolonged tourniquet or dehydration would likely result in slow or no flow from the start, not an abrupt stop after initial flow. For example, if you see a flash of blood and then nothing, or a hematoma forming, it's a strong sign the needle went through the vein. Slightly withdrawing the needle might regain access if it hasn't completely exited the vein. Question 39. What is the primary purpose of the chain of custody protocol in specimen collection? A. To ensure patient comfort during collection. B. To track the specimen's handling and storage from collection to testing. C. To verify the phlebotomist's competency. D. To prevent specimen hemolysis. Answer: B. To track the specimen's handling and storage from collection to testing. Explanation: this question focuses on a critical aspect of forensic or legal specimen collection. The primary purpose of chain of custody is to maintain a meticulous, unbroken documented record of a specimen's possession, handling, and transfer from the moment of collection until its final disposition. This ensures the integrity and legal defensibility of the specimen, especially for drug screens, forensic tests, or paternity tests, by proving that it has not been tampered with or substituted. For example, a sample collected for a legal drug test requires a signed chain of custody form every time the specimen changes hands. Always follow strict chain of custody procedures for legal specimens to ensure their integrity and accountability. Question 40. A phlebotomist is collecting blood for a fasting lipid panel. The patient asks, "Can I chew gum during my fast?" What is the most appropriate response? A. Yes, sugar-free gum is fine, as it contains no calories. B. No, chewing gum, even sugar-free, can stimulate digestion and affect results. C. It depends on the specific tests ordered, some are not affected by gum. D. Only if you chew it very slowly and don't swallow any saliva. Answer: B. No, chewing gum, even sugar-free, can stimulate digestion and affect results. Explanation: this question tests knowledge about fasting requirements for specific tests. The keyword fasting lipid panel is key. Even sugar-free gum can stimulate the digestive system, which can impact certain metabolic processes and potentially affect the accuracy of fasting test results, especially for a lipid panel. Therefore, patients should be instructed to abstain from all food, drink, except water, and gum during their fast. For example, the act of chewing can stimulate insulin release, potentially altering glucose or triglyceride levels. Always instruct patients that nothing but plain water should be consumed during a fast for accurate results. Question 41. A patient reports feeling dizzy and nauseated during a blood draw. What is the immediate action the phlebotomist should take? A. Reassure the patient and continue the draw quickly. B. Stop the venipuncture immediately and remove the needle. C. Have the patient take deep breaths and look away. D. Apply a cold compress to the patient's forehead. Answer: B. Stop the venipuncture immediately and remove the needle. Explanation: this question assesses the phlebotomist's response to a patient exhibiting signs of syncope, fainting, or near syncope. The keywords dizzy and nauseated indicate an impending vasovagal reaction. The immediate priority is patient safety, which means stopping the procedure, removing the needle, and helping the patient to a safe position, e.g., lying down, to prevent injury if they lose consciousness. Reassuring them or applying a cold compress comes after ensuring safety by removing the needle. For example, if a patient faints with the needle still in their arm, they could injure themselves or the phlebotomist. Always prioritize removing the needle and ensuring the patient's safety if they show any signs of feeling unwell during a draw. Question 42. What is the most important factor when selecting a venipuncture site for a patient receiving chemotherapy? A. Choosing the largest vein available. B. Avoiding areas with visible bruising. C. Preserving peripheral veins for future access. D. Ensuring the patient has fasted appropriately. Answer: C. Preserving peripheral veins for future access. Explanation: this question challenges the phlebotomist to consider the broader clinical picture for specific patient populations. For chemotherapy patients, preserving peripheral veins is paramount because they often require repeated intravenous access for medication administration, which can damage veins over time. Therefore, phlebotomists should prioritize using veins that are less likely to be needed for IVs, e.g., dorsal hand veins for blood draws, if antecubital is reserved for IVs, or avoid drawing from arms that already have access. While avoiding bruising is good, the long-term venous access needs are the most important factor. For example, frequently drawing from the best access veins could make it very difficult for nurses to administer life-saving medications later. Always consider the patient's long-term access needs, especially for those undergoing chemotherapy. Question 43. A phlebotomist needs to collect blood from a patient in isolation for Clostridioides difficile, C. diff. What PPE is required? A. Gloves and gown. B. Gloves, gown, and N95 respirator. C. gloves, gown, and surgical mask? D. Gloves only. Answer: A. Gloves and gown. Explanation: this question tests knowledge of infection control and specific isolation precautions. C. DIF is transmitted through contact, fecal-oral route. Therefore, for contact precautions, a phlebotomist must wear gloves and a gown to prevent contact with contaminated surfaces or bodily fluids. An N95 respirator is for airborne precautions, like TB, and a surgical mask is for droplet precautions, like influenza, which are not typically required for C. diff isolation unless other conditions coexist. For example, touching contaminated surfaces or the patient's skin could transfer C. diff spores, so the gown and gloves act as a barrier. Always wear a gown and gloves for patients on contact precautions like C. diff. Question 44. Which of the following is the most appropriate method to dispose of a used needle and syringe after venipuncture? A. Recap the needle, then place it in a biohazard bag. B. Place the entire needle and syringe unit into a sharps container. C. Detach the needle from the syringe and place the needle in a sharps container. D. Place the needle and syringe into a regular trash can, as long as it's empty. Answer: B. Place the entire needle and syringe unit into a sharps container. Explanation: this question is critical for safety and waste disposal. The most appropriate method for disposing of a used needle and syringe is to place the entire unit, uncapped, into an approved sharps container immediately after use. Recapping needles is strictly prohibited due to the high risk of accidental needle stick injuries. Detaching the needle is also dangerous and unnecessary. For example, trying to recap a needle could result in a serious sharps injury to your hand. Always dispose of uncapped needles and attached syringes together into a sharps container immediately after activating any safety features. Question 45. A phlebotomist observes petechiae forming on the patient's arm during venipuncture. What is the most likely cause? A. The patient is experiencing an allergic reaction. B. The tourniquet was applied too tightly or left on too long. C. The needle gauge used was too small for the vein. D. The patient has an underlying bleeding disorder. Answer: B. The tourniquet was applied too tightly or left on too long. Explanation: this question assesses the recognition of a specific venipuncture complication and its cause. Petechiae are small, red or purple spots on the skin, and when observed during venipuncture, they are most commonly caused by a tourniquet applied too tightly or left on for too long. This excessive pressure causes capillaries near the surface of the skin to rupture. While an underlying bleeding disorder could exacerbate this, the tourniquet technique is the direct and most common phlebotomy-related cause. For example, if you see these tiny red dots forming, it means the tourniquet is exerting too much pressure, so loosen it slightly or remove it quickly. Always assess tourniquet tightness and duration to prevent petechiae formation. Question 46. What information is most critical to verify on the patient's identification band before drawing blood? A. Patient's room number and bed number. B. Patient's physician's name and contact information. C. Patient's full name and date of birth, DOB. D. Patient's admitting diagnosis and allergies. Answer: C. Patient's full name and date of birth, DOB. Explanation: this question emphasizes the paramount importance of accurate patient identification, a foundational safety standard in phlebotomy. The most critical information for positive patient identification, ID, is the patient's full name and date of birth, DOB, and often a medical record number. These two identifiers must match the requisition form exactly and be verbally confirmed by the patient, if conscious and competent. Room number, physician, diagnosis, and allergies are important but are not the primary identifiers for drawing blood. For example, drawing blood from the wrong patient due to misidentification can lead to severe medical errors. Always use at least 2 unique patient identifiers, typically full name and date of birth, before every draw. Question 47. A phlebotomist must collect a trough level for a medication. When should this specimen be drawn? A. Immediately after the next dose of medication. B. At the peak concentration, usually 1 to 2 hours after a dose. C. Just before the next scheduled dose of medication. D. Any time of day, as long as the patient has fasted. Answer: C. Just before the next scheduled dose of medication. Explanation: this question tests knowledge of timed medication levels, specifically trough levels. A trough level refers to the lowest concentration of a drug in the blood, which occurs just before the next scheduled dose. This measurement helps determine if the drug is being eliminated properly and if the dosage is maintaining therapeutic levels without reaching toxic peaks. A peak level is drawn after the dose, not before. For example, if a patient is on an antibiotic, collecting the trough level right before their next dose ensures the drug hasn't completely cleared their system. Always remember that a trough level is drawn just before the next dose to measure the drug's lowest concentration. Question 48. During a venipuncture, the phlebotomist inserts the needle, but no blood flows into the tube. Upon slight repositioning, a hematoma begins to form rapidly at the site. What action should the phlebotomist take next? A. Try a new tube to check for vacuum. B. Push the needle further into the vein. C. Remove the needle and apply immediate pressure. D. Redirect the needle again to find the lumen. Answer: C. Remove the needle and apply immediate pressure. Explanation: this question requires critical thinking in a difficult venipuncture scenario involving a complication. The key indicators are no blood flows followed by hematoma begins to form rapidly. A rapidly forming hematoma signifies that the needle has likely gone completely through the vein or is partially out, allowing blood to leak into the surrounding tissue. The immediate and most crucial action is to remove the needle and apply firm, direct pressure to the site to stop the bleeding and minimize the hematoma. Continuing to probe or try new tubes would worsen the hematoma and cause more discomfort. For example, continuing to fish for a vein when a hematoma is forming will only make the bruising larger and more painful. Always remove the needle and apply pressure immediately if a hematoma begins to form during a draw. Question 49. Which of the following is an unacceptable site for routine venipuncture? A. An arm with a shunt or fistula. B. Ankle veins. C. Dorsal side of the hand. D. Cephalic vein in the antecubital fossa. Answer: A. An arm with a shunt or fistula. Explanation: this question tests knowledge of absolute contraindications for venipuncture sites. An arm with a shunt or fistula, typically created for dialysis patients, is an absolute contraindication for venipuncture because drawing blood from or applying a tourniquet to such an arm can damage the shunt/fistula, compromise its function, or lead to complications like infection or clotting. While ankle veins and hand veins are less preferred for routine draws, they are not absolutely prohibited like a shunt/fistula arm. For example, using an arm with a dialysis fistula could lead to the patient losing their access point, which is critical for their treatment. Never draw blood from an arm that has a shunt or fistula. Question 50. A phlebotomist is collecting a timed specimen for a glucose tolerance test, GTT. The patient has just consumed the glucose drink. At what point should the phlebotomist begin timing the collection intervals? A. From the moment the patient begins drinking the glucose solution. B. From the moment the patient finishes drinking the glucose solution. C. 30 minutes after the patient finishes the glucose solution. D. When the phlebotomist first takes the patient's baseline glucose level. Answer B. From the moment the patient finishes drinking the glucose solution. Explanation: this question focuses on precise timing for a critical diagnostic test. For a glucose tolerance test, GTT, the timing of subsequent blood collections, e.g., at 30 minutes, 1 hour, 2 hours, begins from the exact moment the patient finishes drinking the entire glucose solution. This ensures that the body's response to the full glucose load is measured accurately over the specified intervals. Beginning the timer too early or too late would lead to inaccurate results. For example, if the patient took 10 minutes to drink the solution, starting the timer when they began drinking would make the subsequent draws happen too early relative to when the full glucose dose was consumed. Always note the exact time the patient finishes the glucose drink to start the timer for a GTT.